Today in the Investors Business Daily, in Business Briefs, I think, there's an article. Would you read that article, what it says?
Oh, absolutely, Rick. I'd be happy to. It says the title is called Study Questions, Use of Statins. There is no evidence, this quote, there is no evidence that cholesterol-lowering drugs known as statins, such as Pfizer's Lipitor and AstraZeneca's Crestor, help reduce the risk of death for people who do not have heart disease, but are at risk for developing it, a new study said. Although statins are seen as safe, a study published last month found users may have higher levels of liver dysfunction, kidney failure, muscle weakness, and cataracts. And as a result of this information, it looks like the stocks for Pfizer and AstraZeneca both fell a little bit because of that.
Isn't that interesting?
It's getting out there. I'm hoping people are starting to understand it a little better.
Yeah. Another article in that same paper talked about a drug about diabetes. I think that we should inform. This is news that you can use. Hopefully, it can be beneficial to our listeners out there. And also, we have doctors that listen. We realize that a lot of the MDs, they don't have time to read and research as we do. And so we hope that some of the information that we bring is informing to them, and whereby they can question the pharmaceuticals and then provide better service for our community. The other one.
This is also from Business Daily, and this is from June 29th, 2010. And it's in the medical section. It's saying that Glaxo medication tied to heart risk, and it quotes a drug maker, GlaxoSmithKline's type 2 diabetes drug Avandia is linked to a higher risk of heart problems, strokes, and deaths in older adults, and is more dangerous than a rival drug called Actos, according to a new study. Another updated study also linked the drug to a higher risk of heart attacks. Avandia has been on the marketplace since 1999, but in 2 weeks, the FDA panel will discuss its safety. And of course, their stocks also did a slide.
Now, I want to go back there. This drug has been out since 1999. It is proven now that it's doing damage. What kind of damage has it?
Heart attacks, increased risk of strokes, and death in older adults.
And in 2 weeks, they're going to do what?
They're going to sit down and give a discussion on the safety of this particular drug.
The drug's been out 11 years. And in 2 weeks, they're going to sit down and give some safety. I wonder how many people have lost their lives. Again, begin to question your healthcare practitioner. Begin to question what you hear here. There's a reason. Statistics show that the average American that has insurance that's over the age of 40 is taking anywhere from 5 to 7 medication and drugs. We hope what we do here, we hope by bringing you information and knowledge that this will inspire you to become more responsible and make better choices. And that's what it's all about, trying to inspire you to become a better person, making better choices so you can become more healthier. That's what it's all about. And also in today's paper, there's an article about cholesterol drugs for healthy, still debatable, and that's in today's Daily News. Again, 457-1210. If you have any comments or questions, if you'd like to deviate from our outline, please feel free to do. The last thing I'd like to discuss in the last 15 minutes here, and we talked about it, I think we talked about the headlines last week, that cancer is now the area's #1 killer. And that article was in the Daily News, May the 22nd. Cancer now eclipses heart disease as the leading cause of death in Montgomery, Greene, Preble, and Warren and Butler counties, according to the newly released Ohio Department of Health data. Heart disease remains the leading cause of death overall in Ohio and most of its urban counties, as well as in Miami, Clark, Drake counties. though its lead over cancer in those areas has shrunk. What we want to do here, I was shared a report that may be a cause for the increase that we're seeing in cancer. We talked about it back in January. I know we have a caller. We're going to go to this caller, Michael, and then when we come back, I want to discuss a little bit what we think, what is causing, maybe cause an increase of the cancer.
Caller, good morning.